Hi, my name's Corey Pop, and today I am here with Katie Ahern. Katie is an instructor for Oregon State Extensions here in Bend, Oregon. And we're going to be discussing some of the merits of the current health care delivery system in the United States. And I'm going to be asking Katie some questions, and she's going to answer them, and she's going to provide us with information she has from her knowledge and background, and also some of her own opinions on it. So, Katie, how are you doing today?
I'm doing good. How are you? Thanks for letting me be here tonight.
Good. Okay, so here we go. First of all, Katie, what can you tell us about the current health care delivery system in the United States?
Well, first of all, the U.S. healthcare system has not been driven by free market forces in a long time. Government has become a major player, wielding control legally and with regulatory power. Yet, government needs private healthcare to serve its beneficiaries. So this tension of power between public and private forces continues. Healthcare is at 1/5 of our nation's economy. Therefore, it's tied to our economic health. And so enter the Affordable Care Act.
Interesting. So, the Affordable Care Act that was put together by President Obama, will it be successful or not, and based on what?
Well, the Affordable Care Act will be determined in part by how major forces play out in the future. There are 8 major forces. The first one is social and demographic. This is an example would be our aging population, the baby boomers, and that there's so many of them, and they're going to be reaching Medicare age, and the cost involved with all that. The second major force is political. This would be taxes and politicians. It's backwards. Taxes, the politicians wanting to raise taxes for health care costs and just runaway health care costs. The next major force is economic, and this is just basically the cost of health care. Then we have technology, which is the innovations that will promote healthcare costs. It's the research and all the new technologies that they have for healthcare services. Another major force is informational technology, which is just using our technology, our computer technology, to spread information better. Here's ecological force. This would be new diseases, natural disasters, and they have a major impact on public health. Then we have a global force. Examples of this would be the brain drain, where doctors from developing countries come here to the United States, and ironically, doctors here in the United States then go to developing countries and offer their care for free. Another example would be generic drugs manufactured in Asia, and the final example would be like medical tourism, flying to Bangkok to get your teeth done. Our last major force is anthrocultural. This is society's beliefs, values, and traditions, and these are hard to change. The hope is that the Affordable Care Act will decrease the number of uninsured, particularly among the vulnerable and the low-income groups.
Excellent. So those were the 8 major forces involved, if you didn't get those. Okay, next question. Are there any other issues with the healthcare delivery system that you can bring up?
Yeah, there's quite a few issues. One example would be there's a shortage of primary care physicians. The Affordable Care Act needs more primary care physicians. They require that you go to a primary care physician, and we have a shortage of it. Most doctors would like to get paid more if they become a specialty, a surgeon. Not a lot of doctors are interested in going into primary care. There's also a lack of access to health care in certain areas, in rural areas or in high-density, low-income housing areas in the cities.
So now that you've identified some of these issues and problems with the delivery, do you have any solutions?
Well, of course I do. I could talk about promoting doctors to choose primary care area of practice through college scholarships, through grants, through incentives. We could talk about, of course, creating more accessible health care clinics at elementary schools, low-income neighborhoods. We could offer tax breaks to cities or to builders if they design a community health care in their community, a healthcare clinic. But I believe the use of information technology has been something that's not talked about a lot and could be very beneficial. Informatics is technology to keep all our healthcare records accessible for you and for your doctors. So the patient has available access to the records, and it empowers the patient. And I also think little things such as texting to remind me of my appointment or to remind me to pick up my prescriptions that I need is something that could be mainstreamed, maybe alleviate some administrative costs. It's pretty cost effective to do that. I'm a classic example of a female who is 8 months late for their annual appointment. A text would serve me well to go in and do my appointment. These are small changes, but they are changes in a positive direction. Finally, I would be amiss if I did not mention preventive education, such as the importance of nutrition education at all ages. This is an area that often gets overlooked. It gets cut in budgets, and yet it sets up, especially at a young age, children for a healthy lifestyle choices.
Excellent. So, I have heard you are almost completed with an amazing, wonderful class, Healthy Systems Organization. And I'm just curious, what did you learn about the barriers, challenges, and opportunities for our future healthcare delivery system?
Well, I learned that change is needed, and the Affordable Care Act was a start. I'm amazed about our national mental health solution is jails. This is unacceptable. Long-term health care and its complexity, the chronically ill, all have issues of access, and those are things I had no idea about. I am also confident that our healthcare delivery system will change for the better because I have learned so much from my fellow classmates and professor. They are very knowledgeable and have compassion in the areas of public health and healthcare delivery fields, and they have ability to make the change happen.
Awesome. Thanks, Katie. I learned a lot from this.
Thank you for your time. I appreciate it.